Today's subject is what is important, glucose level or treatment? I believe that one most important organ related with diabetes is pancreas. We understand pancreas produce insulin, and this insulin are very close relationship with diabetes. Now, this is we understand. The pancreas produce insulin, but this insulin could not go into cell. And then when we walk or exercise, then the insulin may be able to get into the cell. Then glucose level will be down. My question, why when we do exercise, then insulin may be able to pass through the cell? This is my idea, my own idea, so maybe wrong, okay? So if I am wrong, then, you may, put it in a comment on that, okay? Now, when we walk, exercise, then our body, has producing heat. When the heat comes up, temperature rise, then our body expand, inflamed. Now, the cell, just like this one, okay, then insulin could not be able to pass through this gate. But when this cell inflamed, this become bigger, and then this gate become bigger, then this insulin may be able to get into the cell. Now, why then, regular insulin could not get into? Because insulin itself is more than large than normal. That is the problem. So let me explain to another way. When women are in period, sometimes there is a blood clot. When we see blood clot, then woman usually menstrual pain here. Now, when we treat that condition, that we make more blood circulation into uterus, ovary, fallopian tube, then there is better blood circulation, then no more blood clot and no more pain. In other words, blood circulation better on uterus and ovary, then clot bigger than normal blood will be disappear, then pain disappear. Now, same question, same matter. If pancreas produce large than normal size of insulin, that's because of poor blood circulation into pancreas and into stomach. So now, most of cases that when symptom of diabetes shows polydyspepsia, drink a lot, and polyhydria, then eating a lot, and also polyuria. More urine comes out. Now, what is happen? That's because, very simple to me, that it is too much heat in the stomach. And stomach supposed to go down function. It could not come up, it go down. But heat comes up, then going up. This is the opposite direction of the chi. So now it's very simple. Because a lot of heat in the stomach, I need, to cool down, so I drink a lot of water. That's polydipsia. Then because of I drink a lot of water, obviously I got more water than supposed to be, right? Then because of a lot of heat, then we have to eat a lot more because digestion will be faster. So the way I suggest it is, don't just poke fingers and get the number. We need blood to cure this diabetes. We just 4 times, 7 times a day we do this one, then we are become anemic, short of blood. Instead of this one, what I suggest is make a better blood circulation into pancreas and the stomach. That's it. Understandable? So next time, I try to introduce how to exercise and what kind of acupuncture point I use, and also what kind of herb I recommend. So what I suggest is glucose level. Maybe help some. But the more important thing is we need more blood. The blood contains oxygen and nutrition. Go to normal blood amount into pancreas, then we'll be okay. Western medicine doesn't have this kind of method. Do exercise, then whole body become better, then may help pancreas blood circulation a little improve. So that's why you have to take insulin, then all kind of not desirable idea to me. So instead of poking here to get glucose level, in the toe and around, I explained you already in the last video. However, it is not necessary much because we know what kind of food spike up glucose level. So we got to be careful with those food. We already know about this one. So important thing is how to get more blood, or too excessive, then make less blood into pancreas and stomach. I hope this makes sense. So wait for next video. Thank you so much for your watching.